Hydroxyzine is an antihistamine used to treat itching from allergies. It may trigger some side effects, like drowsiness. Knowing how to handle side effects may upgrade your treatment satisfaction. Side effects from hydroxyzine usually wear off as you get used to the medication. Until then, here are some tips to cope. For drowsiness, ask your doctor about adjusting your dose or schedule. They may suggest taking it at a different time of day, which may help cut back on drowsiness during the day. Avoid operating heavy machinery, like a car, after taking hydroxyzine until you know how your body responds to it. You may also want to skip anything that worsens dizziness, like alcohol. For nausea, try taking hydroxyzine with food. Taking it with food may reduce irritation in the digestive tract. Consider taking it with bland foods, and avoid fried or greasy foods. For dry mouth, try chewing on ice or sugar-free gum. Amping up your water intake may help. There are also mouthwashes and lozenges specifically for dry mouth. For dry eyes, ask your doctor or pharmacist about eye drop recommendations. Eye drops may help calm the pain and may even help you get a better night's rest. If side effects continue to hinder your life, chat with your doctor. They may tweak your dose or suggest an alternative medication. Seek medical care right away if you have any rare but severe symptoms, such as excessive drowsiness or racing heartbeat, or signs of allergic reaction like swelling, trouble breathing, or rash. Otherwise, you should be able to manage side effects safely on your own while enjoying less itch.